Hi, my name is Zoe Greenhall. I'm in the Industrial Design MFA program, and my project is redesigning the pelvic exam. For my thesis, I'm designing a product for women who experience anxiety related to visiting the gynecologist. And why is this a problem? Because visiting the gynecologist for a yearly pelvic examination has been known to cause anxiety, pain, and discomfort for patients. And these feelings of distress have been determined as the main reasons for patient avoidance of the gynecologist, specifically for the pelvic exam. So what is a pelvic exam? First, the patient lies on their back with their feet in stirrups. Next, the physician examines the outside of the vaginal area. Then they insert a speculum into the vagina, which separates the vaginal walls. The physician is then able to examine the cervix. And next, the physician inserts 2 fingers into the vagina to check the uterus and the ovaries. So the purposes of the pelvic exam are to evaluate for pain, bleeding, and vaginal discharge, as well as screen for cervical cancer and sexually transmitted infections. The gynecologist attempts to make the pelvic exam a positive experience. However, many factors of the procedure can make the patient feel quite uncomfortable. There are both psychological and physical stressors that stem from the pelvic exam. Psychologically, patients can experience qualms about vaginal odor, worries about cleanliness, embarrassment about undressing, concern that the gynecologist might discover something about sexual practices, fear of pain, and fear of discovery of a pathological condition. Physically, when anxious, the pelvic floor muscles actually contract and tighten, which can then lead to more pain during the exam, specifically during the insertion of the speculum. Additionally, the exam is performed in the lithotomy position, where patients can feel extremely vulnerable. In the lithotomy position, the patient's legs are flexed, separated, and supported in stirrups. Ultimately, this position involves the exposure of intimate parts of the body in a vulnerable situation with loss of control. So who am I designing for and with? I went to Reddit and I asked, what is the worst part about visiting the gynecologist besides the speculum? Within 24 hours, I got over 100 comments. Comments ranged from feeling like you have no sense of body autonomy to feeling like a stranger is looking at your body to, and I quote, being a woman at the gyno is like being an animal at the vet. So from that information, I move on to my user, looking at women ages 16 and up who experience anxiety and discomfort during a pelvic exam or while at the gynecologist, as well as before or while making an appointment to see the gynecologist. Also just feels a sense of a lack of control at the gynecologist. Moving on to my design concepts and opportunities, I looked at anxiety relief as well as the gown. Looking at my design concept from last semester, I wanted to create some sort of device that someone could take with them to the gynecologist when they're feeling anxious. A product I drew a large amount of inspiration from was the Hug by Mia Sinelli, which is a weighted blanket piece with arm and hand-like extremities that allows the user to mimic the feeling of a hug with pressure to relieve anxiety. So moving forward, I came up with a few design concepts, one being inspired by what I feel when I'm having a panic attack as someone with anxiety. So looking into what I feel I need, such as focusing on breathing, I need pressure, warmth, freedom, and this led to holding something and then animals. So I came up with a few forms that reminded me of an animal that would mimic the warmth, the soft fuzzy feeling, and the weight that an animal would provide. And for my next concept, I looked at the idea of the hug and what that provides for me when I'm panicking and where we actually feel the hug on our bodies. So I looked at creating some sort of wearable device that a person can bring with them during a pelvic exam to help relieve that anxiety. But then I thought, what if I combine the two, so having the feeling of a warm and fuzzy animal while also feeling that pressure of a hug. My hope is that this would help patients go from distressed to feeling comfortable and relaxed. My next design opportunity is the gown. The gown opens in the front and it's made of a thin paper or cloth, and you're given a paper blanket, which is really more like a napkin to drape across the lap. And this is all presented usually like this, which is just placed on the exam table. Going back to my research that I did on Reddit, I found a lot of comments made about this saying that it's really not helping with relaxation, it's never warm enough, it's just really uncomfortable to sit there naked in a paper robe. So is there a way for me to help redesign the gown to help reduce anxiety and strengthen the feeling of control? I personally don't feel anxious when I go to the gynecologist, but my goal with this is to have someone feel the way I do and inspire them to take control of their body. So for my next steps, I'd like to continue the ideation process considering both opportunities, consult experts in touch therapy and gynecology, and create models to begin user testing. Thank you. I'd love to hear your feedback.